Indigenous. I am originally from Stanley Mission. I currently reside in Saskatoon, and my mother's name is Elizabeth Roberts. Her Cree nickname is Matisquis, which means bad girl. She's 87 years old and has lived up to that name for 87 years. She's one of my role models. My father's name was John Roberts. He's been gone now for 35 years. I have two adult children, a boy and a girl, and I have one grandson. Um, the the English introduction of who I am is I am Dr. Rose Roberts. I have a bachelor's degree in nursing. I have a master's and PhD in community health and epidemiology. And I have spent the majority of my career at the University of Saskatchewan in faculty positions or staff positions, helping Indigenous students excel and succeed in their chosen health professions. My area of research and expertise, if you want to call it that, started out in cancer. My mother was diagnosed with cervical cancer while I was doing my master's degree. And because I'm also the nurse in the family, I was the one who was responsible for taking her to the doctor and for her checkups and convincing her that she should go for surgery. Anyway, what I began to notice was that she would come for her checkups and she would spend, 5 minutes, 10 minutes with the surgeon. And she would come back and come out and said, "Oh, the doctor says I get to live 3 more months. The doctor says I get to live 6 more months." And I began to wonder if this was a cultural phenomenon where so much power was given to the doctor, or if it was just her. So that led to my PhD research, investigating stories about cancer among the Woodland Cree. So what I found out after my PhD research was that it was just her. So um, to kind of put it in perspective, and it's something that I've picked up in the work that I've done, is that Indigenous people, First Nations, Métis, and Inuit tend to put a lot of power into a person wearing a white coat. So medical people, medical personnel. So anytime I've talked to doctors or nurses, I encourage them to keep this at the forefront of their minds. There is a power imbalance caused by colonization. So when I was contacted by Michael and asked if I wanted to do a presentation on harm reduction, I had to really think about it because this isn't an area that I would consider my level of expertise. I don't have any answers. So, what I'm going to share with you today is basically what I hope will have some significance, will able to help you a little bit in the work that you do. In thinking about this talk and about my life experiences, I just want to share with you that I have a friend who's HIV positive. He was diagnosed in 1992 and he's still alive and well. So the uh, diagnosis that was happening in the 1980s when it came to HIV/AIDS, I'm happy to say that our relatives are living longer. And the other part is that I retired 4 years ago from the University of Saskatchewan. I was just burnt out. What I tell people was I got tired of telling white people to be nice to brown people. So I'm still in recovery. And um, what happened shortly after I retired was that I took custody of my niece's baby. Um, Jewel was 6 weeks old, and her mother, who is an addict, abandoned her at Sanctum 1.5 here in Saskatoon. And I wasn't going to allow another Indigenous child to be taken into the social services system. So I stepped in, and her mom is still on the streets, is still using, actively using. So I'm sure that you've probably seen all the posters on social media that says every every First Nations, Métis, or Inuit person that you know is either a residential school survivor, is has parents who are residential school survivors, or grandparents who are residential school survivors. And that kind of popped into my mind when I was thinking about this presentation is if you're First Nations, Inuit, or Métis, you probably have been impacted in some way or form by HIV, AIDS, or by the world of addictions that many of our community members are in. Um, so that's where I'm coming from. It's coming from the lived experience of knowing that if, and this was the warning that I received from social services, if my niece comes into my house, that means that I have put Jewel in danger, and social services will remove her from my custody. So I have to make a choice between helping my niece and helping her daughter. So that is the worldview that I'm coming from. Um, and I also want to tell you that here in Saskatoon, we woke up to minus 37 and minus 48 with a wind chill. So I am wearing multiple layers, and it is cold. And I did not leave the house to take my daughter to take my granddaughter to daycare. So you may hear the odd thump happening because my daughter who lives upstairs is looking after her, and there'll be children running around. So I apologize in advance for that. I hope that doesn't put too much interruptions in the presentation that I'm going to be doing. I'm going to share my screen now. I don't have a lot of PowerPoints, but I know that um, as Indigenous people, we tend to work better um, when we have a visual image. So here we go. So first, I want to give a little bit of an overview in the world that I come from. As I mentioned before, I am Woodland Cree, and I want to acknowledge that uh, the audience comes from um, different teachings, different places across Turtle Island, and I want to just let you know that these are my teachings um, based from where I come from. And when you come from the world of academia, it's always about providing um, information on where you got the knowledge from. So in Indigenous worlds, it's all about who you are and where you come from. So as Michael did his introduction, He let you know where he's located from. So he let you know where he is and where he's coming from and who his parents are and his community. And that is something that is integral to First Nations, Métis, Inuit people, no matter where you go. One of the first questions is, who are you? Where are you from? Who are your relatives? Um, and the teachings that I'm going to share with you now, um, they're from one of my elders. And this is the way that we reference each other when it comes to oral knowledge. I received these teachings from my elder Maria Campbell, and she refers to them as the circle teachings. And this is the worldview that I operate from. So, in the center are the children, and in the center of the circle, everything that we do is for the children. They are the inheritors of the North. They're inheritors of the world. They are the inheritors of the knowledge that we hold. So the second circle is the elders. So the second circle is the teachers and the knowledge keepers. And they are closest to the children because they are the ones that have the time. And I'm talking about this, traditionally prior to colonization. So keep that in mind. This is what our communities look like. So the elders spent the most amount of time with the children. So they were able to see the skills that the children had, and they were able to guide the children to hone those skills. So if someone was able to remember clearly, then the elders would be able to hone those skills and they might become the storyteller for that community. If there was a little girl like Jewel, who you would say bossy, then they would hone those skills and that child would become a leader. So the time that they spent together, they were able to see the skills that they had and be able to hone those skills. And the elders also had more patience. I have more patience raising Jewel than I did when I was raising my own children. I was raising my own children, but at the same time, I was also going to university or I was working full time. Now, now I'm retired. I have that time and that space to be able to devote to Jewel and to be able to notice her skills and to have more patience. Um, and the other thing is that the children are coming into this earth plane. So the elders' responsibility, the grandmothers and the grandfathers, is to help those children um, find their space and place in the earth realm, while at the same time, the the elders, the grandmothers and grandfathers are getting ready to go back into the spirit plane. So because the children have come from that plane, then they are also helping the elders to go into that next plane. And this relationship is so sacred that in the Cree word, Nutaban, is the same word used when the children are referring to their great grandparents, Nutaban. And the great grandparents are using the same word to refer to great grandchildren, Nutaban. So it's the same word because that's how sacred the relationship is. And then in the third circle is the women. And the women's responsibility is to look after the elders and to look after the children. They are the protectors. And they are also um, the one of their responsibilities is to provide food to the children and the elders and to the community at large. In some tribes, it wasn't the large game that provided the sustenance for the community. It was the plants. It was the fishing. Okay. So in the outer circle is the men, and the men were the protectors for the other circles. Their role was to lay down their life to protect the inner three circles. And they were also the hunters. So they brought down the big game, like the buffalo or the moose, or if you're talking about the Inuit, the whales. So they brought in large amounts of food to the community. So this was how the communities were organized, right? And when it comes to what the worldview, the English word is egalitarian, in that it was equal. So the way Maria puts it is that grandmother had half the circle and grandfather had half the circle. It was equal, and everybody had their roles and responsibilities. Nobody was better than the other. Everybody was equal. So this was the worldview that we are coming from. And you've probably had knowledge, or you've used other circles like the medicine wheel and the teachings that are um, assigned to each of the four directions. All of these are useful when you're trying to figure out the work that you're doing, when you're trying to figure out the worldview of the people that you are working with. So every little bit of information that you can get from different sources is going to fit in. So this the circle teachings um, actually take probably 4 days. So I'm just giving you a tiny glimpse of understanding in terms of the the expanse that is possible with within this slide. So that's the world that we came from. And then colonization hit, and the Winona Wheeler, who is a professor within the Department of Indigenous Studies at the U of S, came up with this model and way of, she's a historian, a way of creating the information in a way that it made sense to understand where we are now. So the first stage of colonization is steady state. The second is the first encounter. The third is imposition of colonial relations. The fourth is manifestations of internalized colonialism. And then the fifth is indigenization or decolonization or reconciliation. So I'm used to doing presentations that are about 3 hours in length. So I have about 30 minutes. So we'll see how quickly I can talk. One of the differences that people have noticed between Woodland Cree and Plains Cree is that Woodland Cree talk really fast. So we'll see if my Woodland Cree talking can work in this consequence. So okay, where is that? All right. So the steady state, the first one is where in the circle teachings, that's where we were at. Um, Everything functioned according to our roles and responsibilities. We had our governments, we had our own military, we had our trade systems, we had our treaty alliances, and everything was fine. And then with the first encounter in this area, it was the fur traders. They showed up here wanting to trade for furs, and that changed the way that we functioned within our world. Um, because within our world, we had relationships with the animals, and we had respect for the animals. Anytime we killed an animal, we said our prayer. We thank the animal for giving us its life, for the sustenance that it was going to provide us. But when the fur traders showed up, our relationship with the beaver changed. Our relationship with the other fur-bearing animals changed because now we weren't killing them for sustenance or for clothes. We were killing them and indiscriminately. So we could trade them in for the products that the fur traders brought, right? So they were time saving. The guns changed the way we hunted. The kettle pots, they changed the women's roles and the way that they could provide food. So the only way that the merchants could change so they could get their furs was to show us how these items would benefit us. And one of the strengths that we have is our ability to adapt. So the other thing that happened with the first encounter is that there was an increase in intertribal confrontation, right? As the First Nations and were starting to move into other territories, there was increased relations with the colonial agents through intermarriage. This is where the Métis came from as a peoples. So the Indigenous people started to adopt the European ideas. So there was the hierarchical power structure. So the egalitarian power structure started to break down, and the patriarchal family structure started to happen because the worldview creators were coming from was based on the fact that the man was the head of the family. And because of the worldview that they were coming from, they would not trade with women. So the women, the First Nations women, then had to be under their husbands in this relationship in order to trade. So it changed everything, and it also led to substance abuse and use. Down in the southern part of this province was what was known as Fort Whoop-Up. So there was a lot of alcohol that was brought into the trade negotiations or the trading that happened. So it started to cause many changes within our worldview. The third stage, the imposition of colonial relations, the the missionaries brought their European ideals and values and practices. When you think about the circle from the first slide and the relationship between the the children and the elders, there was a lot of patience, but with their child rearing. But what the missionaries saw was that the children were allowed to run amok, that there was no discipline. So the conflict between the worldviews started to play out in our lives. The other thing that they brought forward was that um, ownership of land, and they didn't see that within our world because within our worldview, you can't own Mother Earth. You can't own land. Without Mother Earth, we wouldn't be able to survive. Without the animals, we wouldn't be able to survive. Without the plants, we wouldn't be able to survive. Without the water, we wouldn't be able to survive. So it was different worldviews that were having an impact. So they said that the indigenous people don't own the land. They haven't settled the land. So we were seen as obstacles to progress and settlement. And later on, when Canada became a country, then they used treaties and laws to impose their ideas, their practices. Um, so some of these were Indian Act, which is still in effect today. There was the peasant policy. There was the pass system where you couldn't leave the reserve unless you had permission from the Indian agent. There was the residential school system, which was the systemic removal of children from homes and communities. There was the road allowance, people where dislocation of Métis people to undeveloped roadways. There was the 60 scoop, systematic removal of children from homes and communities. So these were all just examples of what happened to us as First Nations, Métis and Inuit people. And communities were systematically dismantled. There was the undermining of leadership. The chiefs and councils now had to be elected. They outlawed ceremonies. They outlawed the Sundance. They outlawed the potlatch. They determined who could be an Indian and who could not be an Indian. Um, so there is um, there's a lot of historical abuses that we suffered as Indigenous people. And especially in relation to think back to the circle between the elders and the children, well, actually the whole circle. Um, when the children were removed from the communities and sent to residential school or either 60 scoop, the elders lost their role. The the mothers lost their role. The men could not fulfill their responsibility as protectors. Because if you did not send your children to residential school, then you were arrested. And when you were arrested, then your children became wards of the state and they got sent to residential school. So they were basically in a no-win situation. So this is what happened to our communities because of colonization. Um, and the parents were left behind in the villages and they were powerless to fight for their children. So this slide is just a brief summary of the residential schools. Like I said in the beginning, every Indigenous person that you know has been affected by residential school. I attended for 5 years. My, my father attended for 2 years. He provided the matches that burnt down the residential school. My grandmother on my mother's side attended for 6 years, and my children are the first generation intergenerational survivors. My grandchildren are the second intergenerational survivors. So we're always seem to be in this state of suffering some kind of trauma and trying to find a way of overcoming that trauma. So these are some quotes in relation to residential school, um, and the the impact that it had. So the residential school survivors that were there for a long time, they went back to their home communities and they didn't belong. So they went back to the city, but they didn't belong. So that sense of um, dislocation has been difficult for many of us. Um, I knew when I left the reserve at the age of 18 that I wouldn't return. So mine is not the only story that goes along that timeline. So what happens because of this colonialism is that it becomes internalized. You're in the front lines, so you know this. You've seen this in the people that you work with. We have poorer health outcomes. We have lower socioeconomic status. We have poor quality educational opportunities. We have complex or inadequate healthcare support. We have housing crisis, whether we're on reserve or in the cities. We have water issues. We have limited agricultural or resource development support, and we're still negotiating land settlements. So, what this led to is a loss of identity, a loss of culture, a loss of history, a loss of protocols, a loss of knowledge, a loss of language, and a loss of belonging. So, this is what makes us who we are as Indigenous peoples, right? That sense of identity, knowing who you are, that sense of culture, and that sense of history, and those protocols. The ceremony is so important when it comes to healing. Um, and that knowledge and that language, that loss of language, we're seeing that in our communities now, and the younger generations want to know how to speak their language because they are beginning to realize what they lost. So that's and then that's that sense of belonging and knowing who you are and where you come from. And this is why it's so important that we maintain the knowledge of who we are and we bring it back. And this is part of decolonization is as Indigenous communities, we need to reject colonization and we need to reject the role as victims. It's taking back our own power. Um, so it's using the appropriate tools of the oppressor. So it's talking about education, it's talking about having our own lawyers, having our own teachers, having our own economists, having our own doctors, having our own nurses. Um, it's talking about resistance, either through direct and indirect action. It's about reclaiming languages and culture and spirituality and ceremonies and communities. So for an Indigenous individual, it's increasing that sense of safety, increasing that sense of identity, a sense of power. Um, it's also about the sense of autonomy and faith, right, and compassion, and being able to be kind that we come into contact with. So this is about decolonization, and it has to come from an individual perspective, first. And once you've decolonized, and there's no such thing as 100% decolonized person, it's impossible because we are so interconnected with the Western world now. But it's about being able to think from that perspective. And I know for myself, when I was in my second year PhD, was the first time that I learned about colonization. And I nearly dropped out of my PhD program because I did not want to be a part of this Western education system anymore. And what made me come back was making the realization that I will do this so I can help my community, so I can help my people. So that was the start of my decolonization journey. I don't have a clock, so I have no idea how I'm doing for time here, Michael. Anyway, this is the last.
You're okay.
I'm okay. Okay.
Yeah.
Um, this is the last slide that I have for my presentation. Um, and this was a model that my former boss and I created when I was at the Guanama Center for Teaching and Learning. And we called it the power flower of resilience because the indigenous people that we came across, there was a reason why they were at university. Um, so flowers grow anywhere. You know, you walk down a sidewalk and there's a crack in the sidewalk and there's flower coming up from that crack, right? So the flowers are resilient. Um, and the flower here is surrounded by the seven sacred grandfather grandmother teachings. So truth, humility, bravery, honesty, love, and respect. And if you keep those on the outside, any work that you do is going to be guided by those teachings. So in this model, we were working with um, Indigenous students. So the Indigenous student was in the center. And if you're in the center, then you are connected to everything else. So there's the four aspects of being: the mind, emotion, the body, and the spirit. And the if you're being present, then your mind and your emotion are connected. If you're committed, then your emotion and body are working together. If you're engaged, then your body and spirit are connected. If you're action oriented, then your mind and your spirit are working together. And within that is the ancestors who we receive our knowledge from, the land that is so important to who we are and where we come from, and the waters that are so important just in basic survival, and the sky. So this model is very robust because the work that you do when it comes to community is you're in the center, and the work that you do is so important because if you're not present, you're not going to be able to help the people that you're working with. If you're not committed, you're not going to be able to do the work that's required of you. If you're not engaged, the people that you're working with are going to know you're not engaged. And you have to be action oriented in the work that you do. You have to do something. So when I was thinking about this presentation, and I mentioned before that harm reduction isn't my area, but what I realized is that all the work that I've done can be applied into this context of what makes a resilient community. So, just a basic definition: what is community? It's a social unit of human organisms who share common values. And most often, when we think of communities, we think of where we came from. Okay, Stanley Mission is a community, but I left Stanley Mission, so I came to Saskatoon. So I had to create my own community. Um, and you are the community of the people that you work with. I know that um, addicts, their families tend to turn their backs on them. Their friends turn their backs on them because they don't know how to help, or because they've robbed them so many times, or because the friends and family don't know how to help them. So they've lost that community. So you have become the community for them. You have become that safe space. And I am so grateful that you do the work that you do, because without you at the front lines, who is going to be the for the people that are going through the experiences that they're going through right now? So, what is resilience? Resilience is the capacity to recover quickly from difficulties. And as you've heard from my previous slides, we have come through a lot of difficulties. Um, the other definition is toughness. You have to be tough to be an Indigenous person in Canada. So, how can a community build resilience? Um, that's the question I want to leave with you this morning. As I said, I don't know the answers. What I do know is that there there is a reason why you chose this line of work. And I'm grateful that you are doing this work. Now. Hey, hey.
Thank you, Rose. It's absolutely beautiful, and I agree with you too. And in this line of work, you chose it for a reason. And it's being around this environment and everything and seeing everybody very energetic, going out there in the communities and stuff. It's heartwarming. It's like it's nice to see people out there like that. And thank you, of course, for coming in today and sharing your story. Beautiful. And I do want a picture of your slide of the flower. So that one's new to me. I'm like, oh, that's really interesting. But again, didn't give me rich. And I guess we can move on to my friend Jeff. I reached out I was drawn to the patient access of Indigenous spiritual ceremonies. So in regards to what Alberta Health Services office offers, and Jeff reached out and was glad to do a little presentation. So I'm hoping that we can find out a little more insight how it's going, where it developed from, whatever he wants to share with us. But you're up next, my friend Jeff.
Great. Thank you very much, Michael. Thank you, Jimmy. Thank you, Rose, for sharing. And I'm just going to ensure that I've got my screen working. Is everyone able to see my presentation?
Yes.
Perfect. So I'd like to start. Sorry, technical difficulties. Ambastich, Danisada, Oki, Tanse. Hello. In our Indigenous ways, we begin with relationship, our kin, and our land, and the purpose. So I'm honored to be invited to the space with you today to share in conversation about the reduction of harm reduction and healing our community, and it's not a checklist. I carry with me teachings and walk this path of life as a husband, a stepfather, a son, brother, uncle, friend, and with lived experience. Over my past 20 years, I stood at a crossroads where my profession intersects between the Western views and the Indigenous views regularly. And I've learned that one thing over and over again: healing is not just physical, it's emotional, mental, spiritual, rooted in culture, tradition, and the land. As a paramedic, a firefighter, and an emergency manager, I've responded to encountered traumas, illness, loss, and new life. And with this, I've learned it's not only Western medicine that's healing. I invite you to take a moment to settle into this space and acknowledge that I'm joining you today from McKinsis, Calgary, on Treaty 7 territory, the traditional lands of the Blackfoot Confederacy, which includes the Siksika, the Kainai, and the Piikani nations, as well as the Tsuut'ina Nation, the Stoney Nakoda nations, made up of the Bearspaw, Chiniki, and Goodstoney. And land is also home to the Otipemisiwak Métis Nation of Alberta. I honor the spiritual and ancestral connections with Métis people that hold this land, its medicines, and its ceremonies. Similar to Jimmy and Rose, I ask that we take this space and share for learning, listening, and truth. That we walk gently with one another and we lift the voices, teachings, and traditions that have often been silenced and explore harm reduction where there's no checklist of services. Rather, our Indigenous knowledge systems that have practices and no health systems can either support or heal in unintentionally interrupting it. We all have heard, and I want to speak about the two-eyed seeing, how it invites us to look at the world through one eye with the strengths of the Western science and through the other with the strengths of Indigenous ways of knowing. And together, using these two views will benefit us all. Our harm reduction does look different. Between a Western system, we're looking at reducing overdose, preventing disease transmission, and minimizing our acute risks. And those that matter, they save lives. But when we only see harm reduction through one eye, the picture is incomplete. From our Indigenous worldview, reduction is not only clinical, but relational, spiritual, connected to our identity, and it is relational, land-based, and intergenerational. It recognizes that harm doesn't only live in the body, it lives as disconnection. Disconnection from our spirit, disconnection from our community, and disconnection from our land. Disconnection from who we are meant to be, and this is why ceremony matters. It's often treated in health settings as a nice extra or an accommodation for something optional, but after the real care is done. When I look at ceremony policy for Alberta Health Services and now our 4 pillars, ceremonies prevention. In care and community settings, we see this through practices such as smudging to reduce agitation, anxiety, and emotional distress. Elders present as quiet, steady supports during periods of vulnerability. These practices help prevent escalation before it becomes a clinical emergency. They reduce isolation. They calm our nervous system and restore connection by removing conditions that lead to substance use or crisis in the first place. Our ceremony is regulation. Jimmy started us with the beating of the drum. And that's an important part because it brings us to grounding, familiarity with moments of fear, hair cutting and brushing ceremonies to help reclaim dignity and control, and our elders that offer us spiritual guidance during withdrawal or recovery, providing reassurance and meaning alongside medical care. None of these are symbolic. They have real psychological effects. They lower our stress response. They increase sense of safety. They reduce our emotional escalation. And when ceremony is allowed and supported, we see a reduction in the need for physical and chemical restraint. We see fewer conflicts between our patients and our staff, and we see a safer environment for everyone. This is regulation that works with the body and the spirit, not against them. And the ceremony is our continuity of identity. Illness, trauma, substance use are fracturing our identity. Colonization has intensified this by separating us from our ceremony, our language, and our land. For many of our patients, being unable to access ceremony even briefly can deepen harm. Our ceremony restores who we are, where we've come from, who we're accountable to. These are protective factors in our recovery. And without this, continuity of care may keep people alive, but it does not always help them heal. Within our health system, ceremony allows and respects our people and prevents escalation of further crisis. My role within Alberta Health Services and supporting the health system is real systems work. When I started in December of 2021, I came from a fire and EMS background, along with emergency disaster management, but not really understanding the impacts that those have within a health system and understanding health. So I was able to come in and look at a health system. And in June of 2022, we had a wisdom council with Alberta Health Services, and they had an ask for us to look at our traditional healing medicines, going beyond our Western ways, and what does that look like? So I was able to be part of the co-lead team in developing policy for Alberta Health Services. My role involves supporting the access to Indigenous spiritual ceremony across all Alberta health settings. With our recent transitions, we now have Primary Care Alberta, Recovery Alberta, Acute Care Alberta, and Assisted Living Alberta. And I support all 4 of those pillars in being able to bring this operationally. It includes our acute care hospitals, our long-term care beds, as well as disasters, evacuation, and displacement contexts. So when people say ceremony sounds important, but it's complicated, they're right. It truly is. The work was hard. There was attempts to stop it because there's fire and there's striking of a match and there's smoke and there's scent. And there was safety concerns that were preconceived or what people thought. And it was a lot of work within our team and using elders and community to build the policy and educate and share. So we spent a lot of time looking at the fire codes, infection prevention and control, occupational health and safety, risk management, and liability concerns. These were all not imaginary barriers. They were real, but there was a responsibility to overcome those. So the truth was, safety and ceremony are not opposites, and they're not competing priorities. It's only appearing when there's poorly designed or unwilling to adapt from a system. So the ceremony policy required intentional design, the same way we design systems to support oxygen delivery, the same way that we support chemotherapy for our patients in Western medicine, or methadone in our addictions and end-of-life care. There's planned processes. And when we design the system for ceremony, it actually looks like real systems, and co-creation can support healing and harm reduction. This policy was co-developed with Indigenous people at the forefront, using elders, using community, and our Wisdom Council to guide. And it wasn't something where we brought the Indigenous voice at the end. We were building continuously. Shaping the policy, we were able to do training for our staff on ceremony matters, how to accommodate it, what was essential in healing, regulation, and harm reduction. When staff understand the purpose, they problem solve instead of resist. We are creating safe protocols and not blanket restrictions. Blanket restrictions feel safer to institutions, but they create more harm. So instead of no smoke ever, we develop protocols around fire safety, timing, and cultural guidance. Risk management was done with elders and our support teams, not as visitors, not as volunteers, but essential members of our circle of care. And finally, it looks like advocating for decision-making tables where Indigenous voices are often absent. I spend a lot of time going and meeting facilities, leadership teams, and operational people, authorities having jurisdiction like fire departments and other areas to educate them on what our ceremonies are and bridge some of the misunderstandings that exist around smoke and fire around oxygen systems. When we're able to support ceremony in our health systems, we're supporting the person. And this led to shifting mindset. Healthcare professionals are taught to strive for cultural competence. And cultural competence usually asks the questions, what do you know about my culture? What do you know about the person? And we use a checklist instead of protocols and generalized knowledge. It's well intended, but it's limited. Because knowing about a culture does not mean care feels safe. Cultural safety shifts the question, and we need to ask fundamentally, does the patient feel safe in my care? Not, was policy followed? Did I do a risk assessment? Was I personally uncomfortable? But did my patient feel safe? Did I respect their dignity and safety? Did I respect them emotionally, spiritually, and physically? And this is where our harm reduction generally fails. Harm reduction fails when we center institutional comfort over patient well-being, when safety conversations focus more on organizational liability than on preventing harm to our people. It fails when we assess ceremony only from a Western lens. These are important questions, or there are important questions to ask around what if something goes wrong? Is there an infection potential? What if the smoke goes into the ventilation system? We asked all of those questions. We've talked about it. And using our ways and using Western ways and some of the science and research that has been done by other organizations, we were able to share that the smoke generated from our smudge with sage actually has healing properties. And it's not just me verbally saying that, but using the research that someone else has done to actually bring Western medicine or Western process in to see that the negative ions that are produced when we burn sage are connecting to the bacteria in the air and making it heavy and dropping it to the ground, creating a safer environment and cleaner air. Cultural safety requires more good intentions. It's not a mindset alone, it's a practice and a responsibility. Cultural competence requires that I take accountability and I need to have willingness to change my systems, my biases, and my attitudes. Community resilience is harm reduction. And as we go through everything, we're talking about our language, our land, our kinship, our ceremonies, and our connection to community. We often look at harm reduction at the individual level. Safer supply, naloxone, withdrawal management, treatment plans. These interventions are important, but they're an incomplete step. Our systems, our communities, and our history are important. Indigenous communities are not vulnerable. However, we are often described or seen to be that way. When harm reduction focuses only on the individual behavior without addressing the structural harms, the risks miss our root cause. We already have the resilience by being family, being Indigenous. It's not abstract resilience, but living, practice resilience that exists in our language, which carries the worldview and belonging, our land-based practices, which regulate our identity and wellness, our kinship systems, which distribute care and responsibility, which we've heard from, our spiritual protocols, which guide healing and accountability, and our collective memory, which teaches us our survival and continuity. They're not cultural add-ons, they're protective health systems. It's harm reduction in our own way. When we have our community, we reduce hospital admissions, we reduce our crisis escalations, and we build resilience long before emergencies occur. It's not reactive, it's not preventative, it's harm reduction, and we need to help redefine it. In addition to this, my role as Senior Advisor for Emergency Disaster Management is looking at emergencies and disasters and displacement. All of these happen regularly, and we've had a couple of significant wildfire seasons over the past couple of years. And when we look at our evaluations, there's logistics focused. It's infrastructure over people. What does our shelter capacity look like? Where are our evacuation routes? Where are our command structures? But for our Indigenous people, we're forgetting that there's the spiritual, emotional, and relational disruptions that are occurring. We're being pulled from our land. It's a new change. We're being pulled from our ceremony. Every evacuation that I've seen and been involved with in the last number of years, ceremony is often the first thing lost. And it's the first thing that's asked for by many of our communities. They want to be able to smudge. They want to be able to have song or drum. And many just want a quiet space. They want to be able to reconnect. We don't get that at reception centers or our shelters. And at the same time, we're pushing people further away and we're missing to treat the person. So as a protective factor, we need to start planning our ceremonies into displacement and into our community plans. What does it look like when my community is being forced to evacuate? Where am I going to have my connection to community? Where am I going to have my connection to ceremony? How am I going to reduce my harm? And as we bring, or I bring this to the end, I want to talk about a call to action for everyone and create the awareness that harm reduction is not just what we allow, but it's what we protect. If you work in the health system, what's preventing you from allowing ceremony, or what's preventing you from exploring what that next harm reduction piece looks like? If you're a leader in the system, we need to be inviting our elders and our Indigenous communities to the table to talk about harm reduction and what that looks like for them. And for our community members, we need to remember that we are important and we are the strength and we have a voice and it can be shared. With that, I'm at the end of my presentation and I would like to hand it back over to Michael and talk about any questions or things that come up from the group.
Okay. Thank you, Jeff. Beautifully done. I'll just stop the recording here.